that this COVID-19 pandemic is something that is very new. It is making governments uncomfortable. Societies and economics have been stretched to the very limits because it's still evolving, it's still changing, the impacts are still emerging. So nobody truly knows what the answers are, so to speak. We're all just making sure we do our best to ensure that our people are safe. According to the data that we have seen from JMP, 1 in 6 healthcare facilities have nowhere for either their staff or their patients to clean their hands in treatment rooms or even toilets. Additionally, 1 in 4 healthcare facilities do not even have clean water on their premises. Of course, this means that COVID-19 is not just a health crisis, but also a very clear wash crisis. And I know that for people that are listening to me right now, you completely agree with that. The crisis, we believe, it was anticipated to hit developing countries, the hardest given that nearly 75% of our people lack hand washing facilities with soap and clean water. So you can look at that, 75%, almost, people in developing countries are the ones that we hardest hit. That is anticipating, but now it is here, it is now. And in the here and the now, what we are also seeing very clearly, of course, is that it is already showing up that we do not have the facilities to manage this crisis. So investing in WASH by ensuring universal, safe and affordable drinking water and safely managed sanitation services definitely is a life-saving decision. If we all fail to join hands in the wake of this pandemic as it's evolving on the continent and indeed across the world, the existing already fragile healthcare facilities and systems that we have are at risk of further damage. Some are already being damaged, as we know. And of course, the impact of that, we all know also will be more on women and children and persons who are living with disability because they will face even wider WASH inequality gaps. Water supply, sanitation, and hygiene are definitely very central to the rebuilding or building the resilient healthcare systems that we already have, and we're striving to increase our budgeting around this across countries, across continents. So how do we overcome these WASH barriers during this pandemic? For WaterAid, I want to talk a little bit about what we have been doing and why we are so important in the midst of this, working very closely with governments across the entire world. We were set up precisely to address WASH barriers by ensuring everybody everywhere do have access to safe water sanitation and improve hygiene by 2030, definitely. In East Africa, as we all know, WaterAid is the only organization that focuses exclusively on WASH right now. Despite countries embarking on different measures to slow the spread of this coronavirus, or COVID-19 as we call it, the key good news is that it's now clear that the universal response relies heavily on good hygiene practices through hand washing with clean water and soap. That has been the singular thing that is helping to combat in terms of the spread. So that is coming out very clearly. The other one that we know also, for those who have been working closely with us, is that WaterAid has been committed to supporting the utilities within our region in the mitigation of the challenges presented by COVID-19, whilst also helping them to continue to build and remain resilient in case we face this crisis in future. Resilient water and sanitation services and utilities are pillars in times of crisis like this, and helps to ensure that communities can count on fundamental basic services to buffer against hardship and support rebuilding. While the utility sector itself are playing their part in ensuring that they're helping to flatten the curve, they are also among the most likely to be hit hardest with the expected income losses of quite a lot of money. I don't have the specific amount, but we know it is in billions of USD in countries, particularly from the global south. And of course, we know why, because people are unable to pay. Government is making things easier for the people to ease their payment around this because some of the income are also lost. So this pandemic would definitely affect utility workforces. It will interrupt supply chains, and many utilities' revenue would drop very significantly. If unmitigated, many utilities will be unable to maintain current service levels, let alone scale up measures to protect those who are vulnerable and the unserved populations in our countries. Several national regulators have expressed their worry around the financial and organizational capacities of utilities in the short and long term, and are already working on interventions to ensure that we keep utilities afloat. So some of the activities that we as WaterAid have taken up both globally and locally include our support to utilities and municipalities with emergency response by installing hand washing stations, water points, water tankers in slum and informal settlements where it has been working during the pandemic. And indeed, even beyond that, those areas of our interventions as well. We have been supporting local governments, utilities, and communities with digital campaign on safe hand washing using social media, community radio, other countless forms of communication during this lockdown. There's been also a few television interviews that is helping also to shed light on this pandemic and how people can remain and stay safe. Globally, we've supported the Utilities Fight COVID using that hashtag Utilities Fight COVID campaign, which was led by UN Habitat and the Global Water Operations Alliance, as we know. This campaign targets the sharing of experiences on challenges of water utilities and the best practices to fight COVID globally. We have also been advocating for adoption of human right-based approach to safe water supply, sanitation, and hygiene to people who are living in slums and in informal settlements, to the utility regulators and the local governments. We believe very much in the importance of partnerships, particularly on our continent. And that is why for us as WaterAid, we actively seek and work with partners, especially those who have strengths in the areas where we do not have strengths, and then we can complement one another in the work that we're doing. Therefore, partnerships are very important in this region because it also helps us in cross-sectional collaboration, cross-learning, knowledge sharing on proposed solutions to WASH sustainability. And of course, integration of WASH across key sectors to improve development outcomes. Our achievements to date has come about precisely due to our collaboration amongst the governments in Africa, the private sector, the development partners, and a whole lot of other stakeholders. But more importantly, and more that needs to be done to address the existing bottlenecks in the WASH sector by ensuring that everyone everywhere does truly have safe water sanitation and improve hygiene by 2030. Even that we can see is already being challenged with this with COVID-19, because a lot of the resources that we have that can help us in the follow-up and in the flow and the direction and in the milestones leading up to 2030 is already being threatened. So for me, coming together of everyone in this webinar that we're having is one to learn from all the utilities on how they are coping, what is happening, what are the challenges, what are the areas that we can also learn and share those fantastic work that they're doing across our continent and beyond. And of course, that would then lead us to begin to build the necessary resilience against any further virus or disaster that may arise and that shows up like this. So thank you everyone for coming for this webinar, and I really look forward to learning from you all. Back to you, Ronnie. Thank you.
Yeah, thank you very much, Tayo, for that contextual brief and highlighting the importance and the role that utilities do play in this response. So for the presentations that are coming up, we've requested the utilities to respond to 3 questions. The first question is, what initiatives are you rolling out within the current context of lockdown? And the second one is, what key lessons are coming out of your response and what measures are being considered to address the challenges that you are facing? And the last one is around inclusivity. And we asked the question, how are you ensuring that the most vulnerable are reached by your services? So the first presentation is going to be made by Ethiopia. Just hold on. It's going to be made by Ethiopia. Can you confirm if you can see my screen?
Yes,
Yes, we can see your screen.
Yes, we can see.
It is okay.
Yes.
All right. Can you see the presentation from Ethiopia?
Yes. Yes.
Now it's gone.
It has disappeared.
Now you have gone out. Okay, it's okay now.
All right. So may I kindly invite our colleague from Ethiopia, from Selam Town Utility, the general manager for Selam Town Utility, to present what they are doing in response to the 3 questions. Over to you. We have 15 minutes for this presentation, then we go into plenary discussion. Ms. Leo, can you hear me?
Okay, yes, with you. First of all, I want to introduce myself. My name is Lewan Numut from Ethiopia, Selam Water Utility. I'm manager of Selam Water Utility. Okay, my presentation contents are, first of all, I will introduce our background information and initiatives in response to COVID, key lessons and measures to address challenges, inclusivity of COVID response. Finally, I will conclude the presentation. When you go to background information, start from Finote Selam town. Finote Selam is a town in western Ethiopia, located in the Mrab Gojam zone of the Amhara region. In Ethiopia, there are different regions. Our region is Amhara region. Distance from the capital city, 387 kilometers from Addis Ababa, and 176 kilometers from Bahar Dar regional capital. In the town, there are 60,000 people as CSA. Number of in Finote Selam, there are 6 Kavale, 4 urban and 2 rural. The place 1,970 meters above sea level, or 6,289 feet. Let us go to Finote Selam town water supply and sewerage system, or Finote Selam water utility. It is established in 1977 GC, or before 43 years ago back. The utility grade level 2. Total staffs in Finote Selam town, there are 65, 58 permanent, other is temporary. Distribution source of water supply, there are 2 borehole and 2 springs. In the town, there are 86 kilometer distribution lines and 11 kilometer pressure lines, total 77 kilometer lines. Service coverage 76% as GTP to plan. Water customers 9,162. Total capital for the town estimated 80 million or 2 million Great Britain pound. Another side, the North Selam Water Utility, one of the project town of WaterAid, 20 towns project. It was the first top-based performing town water utility, as you see in the diagram. The town received different rewards and recognitions from WaterAid regional and national level. As you see the picture, the town received different recognitions from WaterAid and Amara region. When we go to COVID-19, first of all, I will discuss about the context of national and regional situation. COVID-19 at national level or in Ethiopia, there are 162, more than 162 cases. From these cases, 4 are deaths, other different situation. Even COVID-19, as you see in the diagram, in the whole region affected by this virus, only 3 or 2 regions remain. As you see, Amara region in the arrow affected by COVID-19. So in Amara region, confirmed cases identified in Bahar Dar and Addis Gram, nearest to Finote Selam, I think 40 kilometers near to Finote Selam. In this case, 25 March 2020, the Amara regional government ordered civil servants that are at high risk to work from home. 29 March 2020, a ban on all incoming public transportation vehicles were ordered. 30 March 2020, it was announced that anyone who returned from abroad in the previous 3 weeks should report to the local health offices. 31 March 2020, a 40-day total lockdown of Bahar Dar and 3 other towns was imposed. So the disease affected that much decision. When we go to our activity initiatives in response to COVID-19, our utility started from internal. First of all, our management staff emergency plan prepared for 3 months. Then utility teams established and shifting system introduced. The resources allocated and implementation of the plan. On this, depend on this, staff awareness creation on COVID-19, as you see the picture. Redesigning office setup before our office more staffed. Provision of personal protection equipment and soap and sanitizing, and at every class, as you see the picture. Then preparing hand washing facility both for internal and external customers. Every customer, first of all, wash their hand and enter through the class. Then increase production and distribution efficiency, because the demand of water is increased day to day. So our efficiency increased. Address inaccessible areas by mobile water tanks. On the case of topography, some areas does not get water continuously. So by the system of mobile system, by using vehicles, mobile water tankers prepared. Then goes to external. The utility had a discussion with key wash partners. As you see, the picture we discussed with the wash partners. These wash partners, the health center, education center, municipality, and others incorporate in this wash group. Then town water board and customer forum members, community leaders and representatives, water with water customer. Then after discussion, we preparing joint emergency plan on COVID-19. Establish a steering and technical committee, two types of committee. A steering committee is the decision maker. Technical committee, the day-to-day activity done by this technical committee. Already you have three types of technical committee. Then we collect fund or resource mobilization. Then implementation of plan. After this action, we get key lessons and measures to address challenges. These key lessons are very important to us. Emergency joint plan is important, specific to COVID-19 pandemic. Without collaboration, we haven't done anything. Using existing international setup, institutional setup, and WASH platforms, we have already the WASH platform. By using this platform, we done many things. Mobilization of resources and willingness to support for prevention, especially WASH getting priority. WASH getting priority. Before, nobody does not give priority. Community hand washing practice well developed. Avoidance of traditional greeting with handshake. Extended drinking and entertainment practices minimized. Collaboration with different WASH stakeholders improved. Religious activities like fasting, praying, and praying to God is more strengthened. This is our lesson. Our challenges are this COVID, especially in the utility, imposed high water demand. Dependence on this water demand create shortage of water, limitation of required resources, lack of implementing awareness to action to prevent COVID-19 pandemic, rural to urban migration not stop. It is our problem. Market days, public gathering, especially Saturday, many people collect in the marketplace. These people does not understand COVID-19. So this is another problem. Lack of awareness on COVID-19 is our challenge. Measures taken to avoid the challenges: regular awareness creation using town FM radio and youth media clubs, especially Finote Selam FM radio, by doing drama, literature, and announce posters and other materials, give awareness to the people. So this is very important media. Even uses media clubs by rotating by vehicle, give information to the people, even in the marketplace. Conducting fast maintenance using stock out materials by modification. The distribution of water increase by maintenance an idle line by using stock, and even using modification material. Providing water supply services in fair distribution. Supporting people more affected by the pandemic situation are our measures taken by the utility. When you go to inclusivity of COVID-19 response, this disease or this virus more affected these vulnerable people. Already our utility, low income and most vulnerable people well identified in all categories. In our town, more than 500 households more affected by this disease. Based on this, we prepared special support provided for most vulnerable people, like supply of water, provision of hand wash, soap and sanitizer. To promote or to expand this activity, we prepared proposal and submit to WaterAid Ethiopia. I think for the next time, this activity expand more and use many people. Maintaining proper water system free of charge. Yeah, the system may be damaged. So poor people cannot give where does not offer fee. So we serve freely without any charge. Even the utility 50,000 birr or 12,500 Great Britain pound allocated to support people who are more affected by market inflation due to their low income. So the market increased day to day. This market inflation affected these poor people. Support food materials to voluntary workers who are feeding poor people. So voluntary uses give food this proper. So our utility help these voluntary workers. Finally, I would like to acknowledge WaterAid East Africa Regional Bureau and WaterAid Ethiopia to give this chance. Thank you so much. Thank you.
Yeah, thank you very much for your detailed presentation from Ethiopia and the remarkable work that you are doing. Ladies and gentlemen, we are opening up for questions. I saw Robert, you had a question in the chat box. You are free to take the mic and ask Ethiopia. For those who have additional questions, you kindly type in the chat box. We have 10 minutes for plenary discussion. Over to you, Robert.
Very many thanks, Ronnie, and very many thanks to the presenter. That was really a great presentation. My name is Robert Kampala. I'm Regional Director for WaterAid in Southern Africa. I'm calling in from Pretoria, South Africa. No, my question was mainly related to how did the utility deal with the individuals that would have not paid their bills? Ordinarily, they would have to cut the service. But I wanted to understand, how are they dealing with those individuals that are unable to pay their bills, where at the same time they need clean water in order to practice hand washing?
Great, thanks, Robert. I think let's take 2 or 3 questions. Joseph, you have a question. Proceed, take the mic.
Thank you very much, Ronnie. This is Jean-Paul Bashimana from WaterAid Rwanda. Thanks to our colleagues from Ethiopia. I had a question on the loss caused by this confinement. As you know, big clients for water supply are most of the times these big institutions like schools, even industries, and I think definitely they got some loss. So how are they planning to cover it, at the same time supporting some of their clients who are also affected by the lockdown and who are not able to pay at the moment? Thank you very much.
Thank you very much, JP. Joseph Bansi, you have a question. Take the mic, then we give the opportunity to the Ethiopia team to respond.
Thank you very much. This is a great presentation. So my question is to Ethiopia team, but it may also apply to other utilities. My question is, with the installation of the hand washing facilities, bills need to be paid. So I don't know who will be paying the bills and whether there are some discussions on how this can be managed in the future. So if there are no discussions, perhaps this is another area for consideration at these early stages, discussing with the key institutions and other groups to see how we can manage the payment of the water bills. Thank you.
Great, thank you, Joseph. I think let's take one more. Rob Fuller, kindly take the mic and ask your question, and then we request the Ethiopia team to respond.
Thank you, Ronnie, and thank you for an excellent presentation from Ethiopia. I think my question is in line with other people's, and it's twofold. Firstly, are you experiencing financial issues arising from the wider economic situation with lockdown in Ethiopia and institutions being unable to pay their bills? But related to that, are you also experiencing issues within your supply chains? Are you yet seeing issues with accessing things like spare parts, chemicals, and other related consumable items? Thank you. And PPE as well, actually, for your staff.
Thank you very much, Rob. So Ethiopia team, Mr. Leo, if you can kindly respond to the 4 questions. Colleagues, you can continue typing in your questions in the chat box. Over to you.
Okay. Thank you for your question and the suggestion. The first question is people does not give fee. Our utility already decide to exempt these people without fee because our time is urgent time. So these poor people helped by or subsidized by the town volunteers. This hand washing material already prepared by our utility. These simple hand washing materials already plastic container and gate valves. So our utility covered the water cost and the material cost. For the future, after COVID, even the volunteer association, youth association, and other merchant volunteers covered the cost because our utility must be exit. Due to chemical and other fittings, actually the utility fulfill the material before. Even by the market fluctuation, some materials does not offered in the market. So we used modification as discussed before. We used this modification, and also we have other HDP welding materials to substitute that fitting. So for a short time, no problem. For the future, maybe we'll discuss other stakeholders and we'll solve the problem. Thank you very much.
Hello, Rooney.
Yes, go ahead.
Yeah, I'm Heide from Ethiopia team. I'm One Wash program advisor at country program. So I want to add some pointers. First of all, I thank the East Africa regional team just to provide this opportunity and sharing our experiences and learning from others as well. So in addition to Leo's response, I want to add some pointers specifically on the questions already on the chat box from the participants. The one is about how determine those who are poor. I think as Leo already mentioned, Selam town is one of the 20 towns projects. It's a town who really the top first town water utility during our project implementation. The 20 towns project, it was a 5 years project, so the phase 1 is already completed. So at this time, I think we capacitate all capacity building. It was a capacity building project. There are different components. Among the components is a proper approach. So at that time, to identify the poorest poor or low-income communities, I think the approach that we have implemented in Selam town is a good lesson even for other towns as well. So the community itself is already isolated or baking who is poor and who is not poor. So there are a criteria. It's a community through community participation. I think those proper low-income households are already identified. So in each kabale, they have 4 kabales. So in each kabale, in similar criteria, in participatory of the public, those 500 and plus low-income groups are selected. In phase 1, we already in the project, I think each of them previously they don't have any water supply connection, but in that project, during the phase 1 project, each poor community or low-income households have got an individual tap for drinking water supply. That's why, you know, it's easy just to manage and to support those groups at this time as well. So this is what I want to say, and instead of the hello?
If we can, hello, thank you very much. If we can kindly respond to the question around sanitation. Do you provide sanitation services as well? If any, what are the main challenges they are facing in terms of sanitation? This question is coming from Mbaye. And I think it will be our last question, and I will recommend Ethiopia team if you can kindly respond to the questions that are being posted on the chat box. So if you can highlight the question on, if you can respond to the question on sanitation.
Yeah, definitely. Yeah, thank you, Rooney. Yeah, we have the town is provided sanitation. Even previously, phase 1 project, the sanitation component is urban sanitation is one component. So there are micro scale enterprises who organized and did the solid waste collection, and also at this time we WaterAid with the support getting from the global through Innovation Fund. We are already on the way to construct fecal sludge and co-compost plant as a pilot even in Ethiopia. So we are selecting this town since we have a good lesson, a good platform in this town. So we are dealing with the sanitation. So the solid waste management is well done through the pre-collection, through micro-scale enterprises. WaterAid Ethiopia also supported them a tricycle for them before at the beginning of the previous project. So at this time they are sustained themselves. Even they bought a car at this time, a vehicle, big vehicle, depositing some amount of money and also taking a loan. So they are collecting a fee from the users, integrating with the water utility. So there are a good lesson that we have seen in Selam. So it's well done with, we are not dealing only on water, but we are integrating the water and sanitation as well.
Thank you very much. Colleagues, I know there are so many questions coming up, and I think some of these questions, they also relate to, and they can also apply to the other utilities that are yet to present. So allow me to close this chapter on Ethiopia. But of course, highlighting that Ethiopia, you need to respond in the chat box to some of the questions that are being asked. Can we kindly move on to Kenya? If I can kindly invite Mr. Ambogo Anton, the Chief Executive Officer for Water Service Providers Associations, to take us through their response, learnings and challenges coming from Kenya. Over to you, Mr. Anthony.
Thank you, Ronnie. Thank you for that introduction. Just a little bit of background about WASPA. This is the premier umbrella body of all water companies in the Republic of Kenya. It was established in 2002, exactly 18 years ago. Representing the water service providers, the ones that are referred synonymously as the utilities, or in Kenya we call them the water companies. They consisted of companies which were formed under Cap 486, but now we have a new Companies Act. Now, I don't want to go into the details, but what is fundamentally important is that these are the companies which were charged with a specific mandate of providing water and sanitation services in their respective jurisdiction. So as we are talking now, we have 88 regulated utilities that is in the country, because we have a national regulator called Water Services Regulatory Board. So our membership spans around 70 of the 88 regulated water utilities. So our main function or mandate as an association is to provide a platform for members to advocate and undertake issues pertaining to their development and sustainability. But the main mission that drives us is to facilitate an enabling environment for the water services providers so that they are able to fulfill a number of goals, both at the international level and local level. We are aware of SDG number 6. We have already adopted that, and it's recognized in our progressive constitution 2010, where everybody has a right of access. It requires that everybody should have a right of access to safe and clean water in adequate quantities, notwithstanding reasonable standards of sanitation. So I don't want to dwell on that much. I'll just... Hello?
We can hear you.
No, yes, we can hear you, Anthony. Can proceed.
I can't see the presentation, but I can use mine here. That's what I'm missing.
Oh, okay.
Can I proceed?
Yes, sure. Go ahead, proceed.
Okay. Now, let me proceed. Now, basically, in terms of water and sanitation coverage, our country is categorized as a water scarce country, where the water per capita is 452 meter cubed against the United Nations threshold of 1,000 meter cubed per capita. So according to our regulator, Water Services Regulatory Board, the latest report, which was issued last year, impact report issue number 11, our water coverage is at 57%. Sanitation coverage, this is where we don't have proper statistics, but JMP puts it at around 25%. It is debatable between 23 and 29%. We don't have exact data on it. Some facts about WSPs in Kenya. These are the utilities water service providers. Regulated, we have 88. There are a number which are not regulated, and the regulator is working to bring them under regulation. So these WSPs serve in a population service area of around 22.8 million. And you are aware the population of Kenya is around at 47.6 million. So population served in the service area is 12.9 million. Total connectivity in terms of people who are connected to our systems is slightly above 2 million. Production in terms of water is around 417 million cubic meters. The turnover is close to 20 billion a year.
Sorry, so Anthony, I don't know if you are presenting, it's not showing on the screen. Anthony.
That?
If you are running a presentation, it's not showing on the screen. I don't know if you got into some problems.
It was being controlled by Ronnie. I can't control it from here.
Oh, okay. So
Ronnie, we can't see the presentation at all.
Oh, yes. Sorry, colleagues. Let me beam it up.
That's why I'd requested for permission to proceed, because I didn't see it.
Anthony, please continue. Ronnie will bring it up and then catch up with you at some point because of time.
Yes. Staff in Kenya are around 11,000. The towns is 113. Now, when it comes to the COVID initiatives, let me go to the core of the matter. It is important to note that Kenya is also severely affected by COVID-19 pandemic. As per yesterday, we had a total of confirmed 582 cases, 26 deaths, and 190 have recovered. So where I'm seated now, this is the capital city. This is what is also referred as the Wuhan of Kenya. This is where we have been severely hit by the pandemic. It has also escalated to other parts, including Mombasa, which is under lockdown, Kilifi, and Kwale. There are also some pockets of cases in other counties. Take note that we have 47 counties, and what we are seeing now is that there is a spike. Now, from this pandemic, the government of Kenya has come and issued directives, proclamations, decrees, and protocols to facilitate containment of COVID-19. Now, what affects the water or the wash sector has been communicated further to us by directives and protocols from the Ministry of Water and Sanitation. And I'll just mention out those ones that are key and affect in terms of water service provision. One of the protocol is suspension of disconnection of water supply to customers with outstanding bills for 3 months, effective April 2020. So that means we are unable to disconnect any customer with a bill, April up to June. Now, number two, another protocol is provision of free water to the vulnerable persons. And I think we had discussions with the government, and we agreed that this should be restricted for the time being to the informal settlements. And we are happy that the informal sector in Kenya, in terms of water service provision, is fairly mapped out. So this was not an issue to us. So the initiatives that we have put in place, the 88 and beyond water utilities, because I told you the others that are not regulated, is one, installation of hand washing points, and in which case strategic places that are prone to human traffic were selected. These include market centers, bus stations, informal settlements, health facilities, police stations. As I'm speaking now, a total of 6,512 points have been installed in the country. So these are manned by the water service providers, and they are refilled on daily basis to ensure that continual disinfection is done at the respective points. And this also includes provision of soap. Now, the other initiative is installation of storage tanks and water tracking. As I'd mentioned, you realize that one of the biggest challenges is that our coverage is still close to 60%. So the people who are highly affected with lack of access to water live in the informal settlements. So in which case critical areas without access to water have been identified, and specifically the informal settlement, and 494 water tanks of different capacity ranging from 1,500 to 10,000 liters have been installed. So where there is no water system they can be connected, this is where they are being supplied with water vouchers. So other strategic points within the informal settlements are also directly supplied through water tracking. I can give just a quick mention of Nairobi here, which has the largest informal settlement in the country, which is at around 60%. You talk of Kibra, you talk of Mathare. Here we have deployed around 20 water buses that are doing tracking. So where tanks have not been installed, there is no water, the truck can go there and dispense the water at different points. So I think this one specifically will address the third question, which I didn't look at. It's what are you doing to reach the informal settlement? So this is replicated in the entire country. And as I told you, we had mapped out and we have realized that just the cost of supplying the informal settlement in the country is around 300 million per month. And this is where we have the protocol to provide free water, but it is in quotes because there is nothing that is free. There are other costs that are involved, we shall see in the challenges. So other initiatives include provision of personal protective equipment, gloves, sanitizers, and masks. These have been given to employees. And this is what we have been pushing the government to realize that, and we wrote, I think, to Senate, and also when the regulations for COVID-19 were putting in place, that personnel in water and sanitation should also be recognized as frontline staff, because they are at the forefront, because key to this stopping or preventing and protecting human health is water and sanitation. So the other initiative is reconnecting customers within the network who were disconnected so that they should have access to water. The other one is use of effective communication tools. You are aware that social distancing is the new norm. So our utilities are deploying the use of SMS, email, social media, that is in WhatsApp, Facebook, Twitter. And there are also free toll lines where customers can communicate with the utility. So this one reduces the human traffic just to facilitate the containment of COVID-19. It goes with the limiting visitors and customers also to the company premises, unless it is necessary to have a customer to come into the premises. So there are restrictions to that. So staff are also working in shifts to avoid congestion. And the meetings are now not just only staff meetings that are being conducted online, even board of directors meeting. And I think this is now the new normal, as it is said. So those are some of the new initiatives that on COVID hand washing, I've talked about it. Now, there's also creation of awareness, and I think utilities have gone ahead and they are doing some e-flyers and a lot of messaging on Twitter, WhatsApp, as I've mentioned, also just to create awareness on social distance, hand washing, and any other directives that are important in containment of COVID. Now, if I can move now to the impact, they are both positive and negative, and I think the director in her opening remarks alluded there is drastic reduction of revenue. What we have seen in the past 3 weeks, because it was contentious here, when the directive was given that customers should not be disconnected, most of our customers have interpreted this to mean non-payment. So this has resulted to a dip in collection efficiency, averaging at 95% to 30%. In the country, we collect an average of 1.7 billion per month, which translates to almost the 20 billion I was talking about in a year. So you realize that now the collections are very low. We are hardly collecting 600 million per month. So that is a big challenge, and how we are addressing this is one is creating awareness to the customer on the importance of prompt payment of bills. And we have made it clear that water service provision in Kenya is not financed through the exchequer, because the way the arrangement is in the country is we have a tariff, and this tariff looks at different consumer categories. And that is where you have people in the informal settlements who are served mostly by kiosks and limited connections, have a very subsidized rate. So we have made it clear that whatever you are paying is what is going into buying chemicals, paying electricity, paying staff. So if you are unable, you will see some of the flyers that have attached down there just to bring this awareness to the employees. I also had to hop from one media house to the other and try to bring this awareness to the customer that there is a lot that is involved in terms of ensuring that the water is clean and safe. If you are talking of safety, then it has to be disinfected. And if you have to disinfect, in the country, we are usually using chlorine. And unfortunately, chlorine is not in this country, it is imported. So there is a cost to it. And I think we got some good response. We went both print and also electronic media, which is still that this is an initiative that we are still taking on. And we want also to ensure we have infomercials just to continue, show the process. You know, some people don't understand when they see just water running in the tap. We want to show from the abstraction point, the treatment process, what happens, where you put alum now to remove the suspended particles, you take it to disinfection, you pump it now to high-level tanks, you gravitate it again now to the consumers. There are bursts, people are repairing our stuff. Then there's the issue of billing. And at the end of the day, when the money is paid, it is used for buying chemicals, paying stuff. We want the entire process to be understood by our consumers. So there's also accumulation of debts that is coming in because most utilities are unable to meet their cost of operation and maintenance because for electricity, we require around 250 million per month. For chemicals, we require 200 million. Now, the one that is massive is personal expenditure, where we require 900 million. So if you look at that, if you're collecting 600,000, then you now have a problem with paying your staff. And again, the challenge is you have to ensure the utility is running. So electricity has to be paid, chemicals have to be availed, otherwise the system collapses. So this is one of the greatest challenges that is facing the sustainability of water utilities in Kenya. And we are lobbying with both levels of government. We have had several meetings with the cabinet secretary. In fact, where I'm housed here, the cabinet secretary is just one floor above me. So we meet from time to time. We have given a proposal. This proposal has already been discussed in cabinet. We have been able also to share the same with our development partners, USAID, World Bank, and others to look into it, because if water service provision collapses at this point in time, then you realize that we are at the forefront in protecting now human health. It will mean that hand washing will totally collapse. And we don't want now to imagine what is going to happen to our population. Now, supply of free water, this is something that politicians run with it quickly, and it is a very, very big challenge to us. But now, on our side, we have gotten a directive from government, so we had to comply first and discuss later, which we have done. But the enormous challenges is that where we are supplying this free water, this is where you find that there is very low coverage in the informal settlement. And again, where it is available, I told you the water tariff structure is heavily subsidized. And we were looking at it because if you look at what we charge in terms of 0 to 6,000 liters, this is an explanation I was trying to bring out on the national television. So if you convert it into 20 liters jerrycan, you find there are 300, but we are charging between 200 and 600 shillings. So you will find that rarely it exceeds 2 shillings. So you find that if you're paying 600 shillings per month, then you realize that water budget is a very insignificant proportion of the household income, between 2 and 15%. So when the proclamation is made for free water, people are very, very joyful. It is the people who don't have access that have a problem, because if you are to get the 300 jerrycans, the 6,000 liters at 30 shillings in Nairobi, it means you are paying 9,000 per month. So just look at the disparity. So to me, my challenge to the politicians was look at those people who are not already connected to a water supply. So here, what we think that going forward, how we need to address it, we are learning from our mobile industry in Kenya here, like Safaricom, Airtel, the Kenya Power. They have deployed, and I think they are going fully prepaid. So it means that if you have water, you need to pay for it first. So I think this is what will address the issue of supply of free water. Because if we continue to go at this rate, where water is heavily subsidized through the tariff, then it means the system will totally collapse. Another challenge that we have seen is that we have a lot of non-budgeted items. Water is being supplied through tracking. This was not put in the budget. Hand washing units was not part of the budgets of the utilities and PPE. So to address this, I think when we'll be negotiating tariffs for our utilities in future now, we will want to ensure that there are also contingency budgets on issues like COVID-19 that are not planned and they arise. So we have contingency plans and also some budgets to be included in the tariff to cushion the utility. because you realize that this is a challenge that is in fact affecting the entire globe. So the person you think you'll be running to for support is also in deeper problems. So low coverage in the informal settlement, we have kicked off discussions with some partners in the private sector to see if we can have an arrangement where they can drill a number of boreholes and ensure we have prepaid water kiosks and increased individual connections. Among other initiatives I know the government is putting in place, but I wanted to restrict to what we are doing. So the other impact is reduced meter reading efficiency. Because of COVID, some customers are reluctant to give access to meter readers. So how we are addressing this, customers are being requested to send their meter readings, but the response is not very, very good. Other utilities, what they are doing, they're just looking at the average of the last 3 months, then they are billing on average, so that once post-COVID, then you can go and correct that. So the other one is saying is installation, because now if you have to move into the neighborhood to read a meter, a prepaid meter will save you the trouble of that. So there are positive impacts that have also come. Some donors have supported us in terms of hand washing facilities, tanks, pipes, fittings, and soaps. I think there's a picture there. You will see some of our partners are giving us soap, which we were advocating as an association, and we distributed. So there are also key savings that are coming out in terms of reduced allowances. You find people now do not travel, they do not spend out, even if it is the board of directors. Once we deploy the online meetings, then you may be pay sitting allowances. Unnecessary movements are not there. There are meetings that are held online. So I think those are some of the positives. So in conclusion, before I go to the picture, because the most important thing I think now within the COVID period is now to support the sustainability of these utilities. Because in the country, what we are saying is that the government has come in and is protecting the vulnerable, which we really appreciate. But at the end of the day, somebody who is supplying chemicals doesn't understand that you have to get this for free. So I think this is where we have requested both support from the national government and development partners to enable us walk through. And once we go post-COVID, it would be very important that the effects of COVID-19 do not ravage the utilities and leave them in a very bad shape. So the rest is the pictures. You can see our cabinet secretary. Those are additional boreholes. We have hand washing soaps. These ones were donated by well-wishers. We also received soap and distributed countrywide. You can see water tracking, customer awareness. I think I'm too fast for the presenter. I was in one of the local TV stations there. I visited a number, I think around 5. So I think this is the message that really sang. You can see now utilities showing that there is some work that is going on, and there is a message there that we stand with COVID, we are in the front line, but we're also giving a message there that wash your hands and also stay at home. Thank you.
Thank you very much, Anthony, for the presentation. Great presentation. A lot of questions in the chat box. Can I kindly request Sarine, Dennis, and Chanchao in that order to quickly ask questions? I know you've asked many questions in the chat box. Can you pick one and be brief, so that we give other people a chance to ask as well? Sarine?
Yes, I'm here. Ronnie, can you hear me?
Loud and clear, go ahead.
Thank you very much. Hi, everyone. Thank you, Anthony, for that excellent presentation. A couple of questions, just very quickly. One that I asked Nairobi Water last week at the AFWA webinar, whether the cartels and the informal service providers were dealt with. The answer we received was that they managed to break or dismantle the cartels. But there may be reports of otherwise or contrary coming from the ground. So I just wanted to hear from you, how were they dealt with in such a short period of time? Number two, the issue of energy costs. There's been a bit of a back and forth in the chat box on how reliant the utilities were. We know that it was only a few that were really reliant, and the majority that was still heavily relying on the bailouts and the subsidies, particularly when it came to the energy cost. So just a question in terms of what has been done in, have the counties come up with some sort of discussion with the power companies to make sure that the disconnection is not taking place, or to suspend at least the energy bills? So these are just some of the issues I'd just like to hear a bit more from you. Thank you, Anthony.
Thank you very much. Dennis?
Thank you very much for the presentation. This is Dennis from Uganda. Just a quick one is that there has been a saying that if the utility had already planned some software activities, for example, training, capacity building, and these activities were meant to happen between February up to May or June, and it's not possible to have them. Have you thought of a possibility of securing an instrument? And of course, you know, government resources, if by June 30th for Uganda, you've not used it, it goes back. So have you, in the current predicament of reduced revenue generation, have you thought of securing an instrument? Is it a possibility to secure an instrument to channel the previous resources that are allocated to trainings into covering some of the issues? And the other question was, do you foresee quality reduction in the quality of the water that is being supplied eventually, if something is not done to address the financial gaps as a reduction of the revenue generation? And lastly, most of the countries have focused on case management, surveillance, laboratory, risk communication, and WASH is part of IPC, but there's minimal, and this is going to Ministry of Health, there's minimal or limited direct financial contribution to the water sector. Is it the same in Kenya, and what problem could you be doing to ensure that with these new guidelines that are causing this kind of a challenge, you have more resources directly to you as a utility? Thank you very much.
Thanks, Dennis. Chanchao, can you also be very, very short so that we give time to Anton to respond and we take another set of questions?
And thanks, Anthony, for a good presentation. I was just wondering that it was good to note that there are various, good arrangement has been done for the water facilities for the informal sector. But I wanted to understand that how water is being managed, water distribution is being managed at the point of collection, because that is, in informal sector, that is also one of the, a place which really enhances the risk of infection. So one thing, and second thing, that though I understand that there are challenges in subsidy, but we have to believe that in every cities like Nairobi, where we say that 60% are informal settlements, there is a section of city dwellers who are actually homeless, who lives on the street. So even if we don't give them water, subsidized or free, they will get dependent on automatically on unsafe water or some, unsafe water. Or we'll have to, as a city maker, we'll have to make some arrangement for them as well. Thank you.
Thank you very much. Over to you, Anton.
Now, thank you very much. I'll try to respond to whatever I had. I've had a lot of interruptions, a lot of people calling me and interfering. So I miss a lot of questions when the calls come in, especially for Dennis. But for Sarin, what I can say, am I audible?
Yes, yes, you are. Go ahead.
Yes. For Sarin, what I can tell you is that the Nairobi cartels are not dead. They are alive and kicking. So nobody should cheat you that they are not there. So what has happened is that you are aware that the water demand in Nairobi is around 770,000 cubic meters per day. The installed demand of Nairobi Water, and I think what they provide is around 525,000. So there is a disparity already. And the 525,000 we are talking about, there are losses of up to 50%. So that water is not sufficient. What has happened in Nairobi is that there are a lot of boreholes which have been drilled. And these people have gone to the extent of becoming their water supply and connecting people. These are the people who charge 20 shillings per 20-liter jerrycan and above. Now, what I can tell you is that what I've seen is that the regulator, WaterAid, and the Waterworks development agencies, what they need, they put a publication, and I think it was 2 weeks ago. And in light of COVID, I think the regulator has just woken up to his duties to ensure that they are able to manage these other people who are supplying water, because anybody who is regulated. So what the regulator wants to put in place is to establish a data bank of these people who are already supplying water. So I think to me that is a very good move, so that there are standards that they are supposed to meet. And that one will go hand in hand with the issue of Chanchao, who talked of the informal settlement, where the point of collecting this water. Mainly, there are 3 ways of supplying the informal settlement. The practice is through the water kiosks. Mostly, these are the ones that are controlled by the water company, like in Nairobi here. And those ones are collected through the containers that come from the households. And this is where we encourage. It is just an issue of creating awareness in terms of hygiene. So I think it is our duty to enlighten the customer that they also have to practice and maintain high standards of hygiene. But at our point, we ensure that the facility is disinfected and the water that is provided is potable. Now, the other issue of water bills, the energy cost is that, yes, we are talking of a full cost recovery tariff, and mostly in our country, this may not be possible because of the costs involved. As you go towards the lake, you find that companies rely heavily on energy cost because they pump against gravity. So in this case, there is high power use. So there are those that are subsidized, and counties which were subsidizing are continuing to do so. So what we have lobbied the government, the national government, and that one has already been done. The cabinet secretary had discussions with the colleague in energy. So there is no disconnection for electricity during this COVID period. But we are not off the hook because the bill will accumulate. Post-COVID, we are going to have a challenge of paying the accumulated bills. Now, in terms, for Dennis, in terms of quality, I think the major challenge is that we are facing now, we have a lot of floods in the country, and some of, like recently in Geth Water Treatment Plant, Kamakwa in Nyeri and Thika were totally submerged because of you find the water was coming in the floods, very high turbidity, we could not control it. And I think now that one moves it from bad even to worse. So that means that if you are using now chlorine, not chlorine, alum, then you need to move to a polymer, which is very, very expensive. So I think what we will do is that we have brought this to the attention of the government and we are continually engaging them. If we are unable to provide safe and clean water, I think what we will do, we will not pump, we will stop. And already we have sent the red flag. We will tell them because of lack of chemicals and these other requirements, we are unable to supply. So to comply with the international laws, that is WHO, WaterAid, to ensure that we don't provide unsafe water and to protect human lives, we have stopped pumping. Hello.
Yes,
Hello?
Anthony, you can go ahead. We can hear you.
Yes. I think those ones are the ones which I was able to capture. Dennis, I missed some. I also have Kenyan colleagues on the platform, and if they can support me, that will be good.
My other one was...
Sorry, go ahead.
No, my other one was that there is a possibility I've had in a few utilities that if you had funds secured for trainings, workshops, and now they can't happen, and there's a situation instead of, for example, you've said when it gets to the situation where you have to completely stop pumping, is there a possibility that funds that were secured for activities that can't happen now can be converted to do the most urgent items as we find probably more sustainable solutions?
Good question. Now, what happens in the utilities that you are aware that we bill in arrears? We supply water, then you issue the bills, then the customer pay. You see how it is catastrophic, and there is a sharp decline in revenue up to 30%. So that means that whatever you are getting is not coming in, even if the money was budgeted. The issue is the actual cash flow. It is the destruction of the liquidity structure, because most of the items now have been suspended. Yes, you would want to reallocate. The issue is that it was budgeted, but it has not been collected from the customer. I think that is the challenge now that is confronting the utilities, because basically where we are now, we are looking, the priorities is to ensure water is flowing. So that means it is disinfected, to the required standards, it is distributed. And also the employees who are there are protected and are able to provide this service. So we have minimized to ensure that the priority is to keep water flowing. Now, even if the priority remains is to keep water flowing, this money solidly has been coming now from the consumer or the customer. Now, the money is not coming, and that is the elephant in the room. And this is the discussion we are having in government, because totally in Kenya, water service provision is commercialized.
Hello, Anthony.
Yes.
Thank you. Maybe we can take two more questions. At this stage, I'd just to be able to wrap up on your session, I'd like to invite Finote to kind of give us the question, and then we're going to be followed by Abdul. Hello, Finote.
Hello, David. I think we lost you a bit. If I heard you well, you had said that we give the opportunity to Finote. So, yes. Finote, if you're online, kindly take the mic so that we conclude on Kenya and move on.
I think we may have lost Finote. Maybe we go to Abdul Nashiru.
Hello, thank you very much for the presentation. Really, really helpful, especially the passion with which you recounted some of the challenges that you face. And in the chat box, I already indicated that during this period, the utilities are going to come under immense pressure. And I think it's the right time for these utilities to collaborate with other institutions to be able to deal with this burden. I also drew attention to the fact that a number of governments in Africa have provided, have guaranteed free water for low-income communities, just to make sure that within this period where we're trying to prevent new infections, that they actually have access. Otherwise, everybody's rushing to get water to store and so on. How do we ensure that we partner with other institutions to make sure that the few functioning systems do not witness overcrowding and high pressure, that they also break down? No, this is going to be very, very essential in dealing with new infections. Thank you.
Great. Thank you very much, Nashir, for those comments, and a big thank you also to Anthony for the remarkable presentation. A lot of key learnings coming out of Kenya. If I can kindly take this opportunity to invite the Tanzania team, Engineer Felix, are you online?
Engineer Felix is out a bit, but he left me to attend the presentation now, but he will be around in a short time.
All right. Are you able to present, or we wait for him?
Let's go on. There is no problem. We can go on. Yes. Okay. Can you hear me?
Yes, loud and clear.
Yes. Yes.
Proceed.
Yes. Yeah. Our utilities, Arusha Urban Water Supply and the Sanitation Authority, is one of water utilities in Tanzania. It is located and is working in Arusha City, northern Tanzania. And we give service to some townships also near Arusha, which is Longido, Monduli, Ngaramtoni, and Usa River. And as for now, we are saving about 500 people who live in these areas. But our customer base now is around 60,000 customers we are saving. We work closely with WaterAid in Tanzania and the other partners in the implementation of Arusha District Rural Water Supply and Sanitation Services, and they are funded by DFID. The first public operated hybrid grid solar powered reverse osmosis or RO plant in Tanzania is located in Ngaramtoni. It's so-called the 5 Villages Water Supply Project, and as Yausa, we will be taking the overall management of the water scheme, which was supervised by WaterAid Tanzania. In supporting the government initiatives in responding to COVID-19, the authority had some initiatives in order to respond to this eruption. First of all, we have internal efforts, but also we have external efforts in supporting the government towards fighting this COVID-19 eruption. You can see that internally we have installed the hand washing facilities, and we have put hand sanitizers in different corners of the authority, not only in the main office, but also in the branches, all of our branches and the water production stations. But also we provide a personal protective equipment to all staff. And also we have announced, we put it open that every customer coming for service at our customer service desk, although we have restricted the number of customers coming in for service, we encourage them to use online customer service facilities like calling our customer call center. And normally the bill payment and the other payments is done online by using mobile phone networks and the bank agents. But as we are talking now, the few number of customers coming in for service there, they must put on a personal protective equipment. And externally, as an initiative to respond against this COVID-19, we have done the installation of permanent hand washing facilities in high-risk areas of Arusha City. and we have ensured that the adequate supply of water to our service areas is provided, although there is a shortage. There is a shortage of water supply. We are going with rationing, and the authority ensures that all service areas access water during this crisis. Also, we have instituted a poor water supply connection strategy. Here we received a support from the Dutch based water utility called the Vitens Evidence International. They have supported us in this initiative to ensure that the low income who are vulnerable as regards to COVID-19 are accessing water. So we do connections, subsidize the connections to these vulnerable people, especially the low income areas. Here we have a target of connecting more than 2,000 low income customers. Now we also reviewed our disconnection procedures for those customers who failed to pay their areas. So now during this period we don't disconnect customers, but we just tell them to come. We encourage them to come and pay their bills. We educate them on the importance of water at this material time, so that they can have enough water to wash their hands. So depleting or lessening disconnection measures to customers with medium and high water bill rates. Here is a picture of one stationed water hand washing facility, which is situated at a public place. We have key lessons which we have learned from this crisis period. One is responding to COVID-19 inquiries. We have joint efforts from the government, private sector, and the other actors. Water utilities have a key role to play in responding to COVID-19 because the water utilities are right at the center of the crisis, because they should provide the water and wash-related items. And we also learned that good hygiene practices should be a lifestyle always, even after the crisis, after the COVID-19 crisis. 19 present an opportunity to figure out how different partners can work together in sustaining this behavior. We also learned that the community is composed of individuals with different needs. It is important to consider these needs when we respond to this crisis and other crises more than COVID-19. But now we've learned that we must put them in consideration when responding. And as the authority, we've just started to roll out initiatives in responding to COVID-19. We hope to learn more as we continue implementing the initiatives towards fighting COVID-19 eruption. Challenges we face includes limited funding for fighting against COVID-19, as no budget was allocated because this is an emerging crisis. So we had no projections that there will be a crisis coming like this. But as per now, we are standing with the financial capacity we have. But real finance is is a challenge to us. Now, how to address we are challenged also on how to address the needs of different groups when responding to COVID-19. So, you know, every group or every social groups have their different needs as far as water service and the other wash facilities is concerned. And also our challenge, another major challenge is where to position hand washing for infrastructure, the areas, because we have multiple entries and exits. For example, in a bus, in a public place like a bus station, you know, there is a big place where there are a lot of exits and entries in the station. So this is also a challenge. But in addressing these challenges, we have collaborated with the other wash players. For example, as I said, WaterAid, and the other partners like the central government, the regional government, FDB, and the other players. Also, we have done installation of inclusive hand washing facilities and the institution of pro-poor initiatives to ensure that the poor and who are vulnerable can access our services and also hand washing facilities. As far as inclusivity of COVID-19 responses is concerned, we see that installation of inclusive hand washing facilities is very important, and it must focus all groups in need, especially the low income and the vulnerable. Also, the authority has prioritized the 2 areas where to install hand washing facilities for the vulnerable groups. We have instituted also, as I said, pro-poor initiatives. And we also support the quarantine areas where by providing water in those areas. We know in Arusha, we have one quarantine area, which is situated at the Institute of Accounts, Arusha. We ensure that the quarantine area there access enough water for safeguarding the health and of the people around there. In short, this is what we have prepared to share with the other partners in East Africa. Thank you very much.
Thank you very much. Colleagues, I kindly request that we take on Uganda's presentation as well. Then we ask our questions later. Apologies for these quick adjustments. I think there are things that are happening beyond our control, hence this request. If I can kindly upload the Uganda presentation, then we ask the 2 countries together. Hello, can you hear me?
Yes, sure, we can.
Yes, we're waiting for the presentation to show.
All right, I'm bringing it up.
Yeah, maybe as it's coming up.
So maybe Ronnie, as you bring it up, colleagues.
As it's coming up, can I be introducing myself?
Yes, go ahead.
Okay, I'm Herbert Nwamanya. I work with the Ministry of Water and Environment in Uganda, and I will be presenting the Ugandan part. In Uganda, and like maybe most of my other partners, I'm not going to present a particular utility. I will be looking at the entire country. As I mentioned, I work for the Ministry of Water and Environment in the division that is supporting utilities. So for that reason, I will try to give what has taken place within the country. As a bit of background, of course, we all know it started in China. It has covered nearly the entire world with 200 nations already affected. Currently, we talk about 3.6 million. I think it should have reached 3.7 plus. And in Uganda, by the time I wrote this report, we had 97 cases, but I'm told now we have reached 100 cases, and it's spread throughout the entire country. You may know Uganda is under, call it a partial lockdown. We're in the third phase. We started with 14 days, then we got 21 days, and now I think 2 days ago we got another 14 days. And what does that mean? It means all services, apart from what we call the essential services, are closed. And in the essential services, we are looking at health, water and power supply, or transport. Public transport is not allowed, and private vehicles are not allowed to travel unless you are looking at the essential services. I think you're moving a bit too fast. I still need the other slide. Kindly bring it back, okay? So in Uganda, we have about 1,400 piped water supply systems that are supplying large towns, small towns, and rural areas. And we have 7 utilities. The big one, which is the National Parastatal, National Water and Sewage Corporation, and then we have the 6 umbrella organizations that are based in the different regions of the country. And we also have some systems that are community managed. Now the rest of the systems are direct, the rest of the other communities are getting point water sources. For my presentation, I will largely look at the piped water supply system. Now, with the incoming of the COVID-19, what initiatives have we taken on? They are largely, I think we need the next slide, yeah. Policy directives. There are quite a number, but I've just picked the few that are affecting our utilities. And the main one, the main directive we got is that water must continuously flow to all the consumers that are connected to them. And have been also requested to extend water supply to what we term as quarantine centers and isolation centers and the food markets. The food markets have been considered as essential, so they are continuous. For them, they are continued working, and we expected to have hand washing facilities with soap, and we must practice social distancing at our water collection points and in all those marketplaces. We are not allowed to disconnect anybody for non-payment. And the other issue that are coming in that affect our operations, any vehicle that is allowed to move, even for the essential services, is not allowed to carry more than 3 people. And if you have a motorcycle, you ride it alone. And then, of course, we are required to continuously sensitize the public about COVID-19 and the way we are moving. We are allowed to walk. Everybody is allowed to walk. If you are talking of your essential services, you can walk to the nearest point where you can pick it. Yes, so what are the challenges, the lessons learned and the measures that have been put in place? We've got a lot of reduced mobility. It's also for the operational staff of the utilities. And with the restriction, the number of people who can be on a motorcycle or vehicles, operational costs have increased, including the cost of providing hand washing facilities. Like our other colleagues, we have seen significant reduced revenue of up to 70%. So most of our utilities now are collecting 30% of what they used to collect. And this reduction largely due to the reduced customers with the closing of hotels, schools, and all that. And then some of the customers are not paying after getting the policy for them. Like I think in Kenya, they mentioned after getting that, people take it like no payment means free water supply, so they are not paying. And what measures have we put in place? Largely appealing to government and other partners to try and look for a subsidy to mitigate this loss. If it's not provided, we see a huge challenge that is befalling all our utilities in the country. We have also come up with quite a number of project proposals, which we've shared with the government and the development partners, largely to help in extending water to areas that are not served and are largely high risk areas. And as I mentioned, such as the quarantine centers, because normally if you have we get anybody with a contact with the COVID-19 case, then you are quarantined for 14 days, not in a hospital, but in a quarantine center. So that if you find you are sick, then you are treated. If you're not sick, then you can return to your home. Finally, I think we can move on to the inclusiveness. Unfortunately, most of the vulnerable groups stay in high-risk areas. You know that in Uganda we have, I think, the highest influx of refugees. You look at the slums and other concentrated settlements like the fish landing sites and the marketplaces, they are highly concentrated, and that's where the poor and the most vulnerable people work. So the project proposals we have come up with are specifically targeting some of these areas. And in particular, when you talk of the no disconnection for non-payment and trying to reduce the congestion at public standposts and extending of these pipelines are geared towards the vulnerable groups. In Kampala, the biggest area, I think we've also had the case of water bowser to extend to some areas. We have prepaid meters to most of the slum areas. They already connected water. And as I mentioned earlier, we are not disconnecting anybody for now. And with the reduced revenue, of course, it's a huge challenge. Thank you so much. I think that is some of what I thought I should share with you from Uganda.
Great. Thank you very much, Engineer, for your remarkable presentation. And also a big thank you to the Tanzania team once again. So David, can you handle the questions? May I kindly request that we be very brief in terms of our questioning to the two countries? David, over to you.
Thank you very much, Ronnie. I think at this stage, because Tanzania had begun the presentation, we can have 3 questions from Tanzania, but for the Tanzania team, maybe we can have Tekaling, Dedo, and Priya in that order.
Hello?
Hello?
You say Tekaling?
Yes, Tekaling. Please ask the question for Tanzania, please.
Well, mine is a general remark for the utilities. Also to look at the impact of this outbreak from the perspective of achieving the SDGs, in its very broader sense. I can see now, I can learn, impacts, the short-term one on the utilities revenue generation capacity, also impacts on the water supply, the demand is increasing, all these things. So just it is a kind of, a remark for the utilities also to be a bit proactive and look at the achievement of the CGD, especially the impact of this outbreak on that one. Thank you very much.
Thank you very much, Tekaling. Maybe we go to Dedo. I hope Dedo you're not on
David.
Dedo, are you there? We can't hear Dedo. Can we move to the next person?
Yes. Yes.
Priya, can you ask your question? We can't hear Dedo.
Okay, hi, thank you very much for all of the presentations. They're very, very good. My question is for Tanzania, but also maybe a little bit relevant to Uganda. On how are you identifying the vulnerable groups, and how are you making these facilities inclusive? And some of your learnings about what are some of the challenges you're facing in trying to do that would be really useful for us. And I wonder also if you're working with other ministries in government or other services to identify vulnerable people or households or groups. Thank you.
Thank you very much, Priya. Maybe we can ask Engineer Felix to take these questions before we move on to Uganda. Tanzania, please.
Thank you very much, Mr. David. Okay, I think the first one was from the first contributor is a remark about the impact of the outbreak of the COVID vis-a-vis water supply demand. I think that was a remark. But what I can say about that is that, of course, the impact of COVID outbreak, it affects a lot, but we are trying to work hard on just to struggle for achieving the issue of water supplying, which is safe water supplying to the community. Also, to go to the question of Priya, he says that how do we identify the vulnerable groups? First of all, when we were establishing the hand wash facilities, we've looked about the areas with high risk areas. For example, at the bus stands, at markets, big markets and also in the health centers and the hospitals. And okay, and to identify these vulnerable groups, it of course it is a little bit complicated because we have the disabled, we have the disabled, we have the people with high risk of being affected. For example, children, all these are the vulnerable groups. But it was not so easy because these vulnerable groups are within our society. So we are trying our level best to make sure that all these vulnerable groups, they will go to the services, but in a manner that there's no risk of getting the COVID-19.
Thank you very much, Engineer Shayo. I think at this stage, we'll move to questions to Engineer Herbert. And I'm seeing 2 questions so far. Maybe we can start with Puneet. Puneet, I don't know whether your connection is okay for you to ask the question, or would you like me to ask it for you? And then from there, we'll go to Chanchal.
Thank you. I can ask the question. My question is to Engineer Herbert, is that the projected revenue losses are on account of deferred collections due to no disconnection policy and non-payment at this point of time, or this is because of enhanced free supplies or increase in the water losses during the pandemic times?
Thank you, Puneet.
Am I clear?
Yes, you are very clear.
Okay, thank you.
Then can we go to Chanchal, and then I see Dedo has got one question. Dedo, I hope your connection is good. Chanchal.
Yeah, actually, I was very happy to see this. There's no disconnection for non-payment. But I was interested to know that how does this apply to the urban poor, like in city like Kampala, where people are, having the prepaid token and they use it for fetching water from the public points. So how does this apply, like non-payment? Are they getting automatically charged or some getting free water? Because of the affordability issues, number of slums in Kampala are also drinking the spring water. So how does this impact in the COVID-19? Had this number has increased for the people depending on the spring, or and national water has done something for them? Yeah.
Thank you very much, Chanchal. I'm going to read out the question by Dedo. She's very happy that you have, and this is for both Tanzania and Uganda. She's very happy that you are addressing vulnerable groups and the pro-poor water strategy. Her question is, how are you making sure that the pro-poor tariffs are supportive of future payments? So over to you. And I think maybe we can take one question from Rob. Rob, I see a quick question. Kindly ask it, Rob.
Thank you, David. Yeah, question specifically for Engineer Herbert. Those towns that are not under the direct management of either National Water or one of the umbrella authorities, do you have any information about how they are coping with the pandemic? Are they in a position to offer free water or other pro-poor support services as well?
Okay, thank you very much, Rob. Over to you, Engineer Herbert. I think you can take a couple of questions.
Okay. Thank you so much for the questions. The first one, which was also posed to Tanzania about how do we identify the poor? Not the poor, but the vulnerable. And are we working with other organizations or other ministries to identify them? The point I would make here is we are not identifying them now because of COVID, but it has always been a government policy to always identify them and make sure they're included in the service levels within our utilities. So we already had the map of where they are, where they live, and they were targeted. Actually, if you look at all our water utilities, wherever we put the public tap stands, they are already targeting those people, so they already identified. So the other question was on the 70% loss, whether it is the flood correction, whether it is increased consumption, and all that. So actually, the three questions, the three questions he was putting in are actually the answers. All of them do contribute to that. But the biggest being the policy directive, because the moment people were told you will not be disconnected, even when you are not, when you have not paid. So everybody is saying, okay, let me wait and see what is going to happen. I'm not paying. Then, of course, it's a danger. Much as we are calling it the FAD, most of those people are not working. So much as it is FAD, we are not seeing them being able to pay later on. And of course, we have increased the consumption with all this kind of hand washing, and in particular, the biggest consumption is with the health facilities. Much as it's not directly arranged with COVID, largely with COVID, but the other diseases are still there, and the patients are on, and they are using water for now, knowing that there is no payment. How does the prepaid system help with no disconnection for non-payment? Certainly, I don't know the one who asked whether he's aware. In Uganda, if you have a prepaid system, a jerrycan or 20-liter jerrycan of water is at 25 shillings. It's only in areas where we are talking of a public tap, where you have somebody running it, that it doubles to 50 Uganda shillings. So the amount of money you are paying for the prepaid system is already highly subsidized and highly proper arrangement. So much as you may not be disconnected, but the amount of money you are paying is so low that it will come into help you, and it's already targeting you at the vulnerable group. I think the final one was about the systems which are not directly under national water or the umbrella, whether we have information. Yes, we do have the information. You may have noted in my presentation, the other systems which are not managed by the umbrellas are supported by the umbrellas. And the umbrellas, they are not directly managing, but they are supporting them with the like monitoring, like water quality testing, like a bit of simple repairs, and they are collecting the reports. So we have the information, and the communities are also coping with this. They have continued supplying the water. Thank you so much.
Thank you very much, Engineer Herbert. Over to you, Ronnie.
Thank you very much, David. Thank you very much, colleagues from Tanzania and Uganda for responding to the questions. We have the last presentation from WASAC, Water and Sanitation Corporation from Rwanda. Unfortunately, because of connectivity, they were not able to join us. But we do have their presentation. So we are just going to walk you through the presentation. Sorry, colleagues, can we mute our microphones? So can I kindly request Maurice to take us through, this is a 5-slide presentation on what WASAC is doing in COVID response. So if you may, colleagues, type in any questions for WASAC in the chat box. We'll take this opportunity to present the questions to WASAC and back to you. Maurice, over to you.
Thank you very much, Ronnie. Good afternoon, everyone. My name is Maurice Kwizera. I am the country director of WaterAid in Rwanda. So greetings from Kigali. I need just to make sure that I am audible so that I can proceed with WASAC's presentation.
Loud and clear.
Loud and clear.
Fantastic.
Please.
Fantastic.
Loud and clear.
So maybe a little bit of WASAC's background. Rwanda has one national utility, WASAC, Water and Sanitation Corporation. And this is the only utility serving the 12.5 million people in Rwanda. For sure, more than 80% are in rural. But WASAC is providing services to both rural and urban in different arrangements. WASAC is a private and state-owned company in charge of water and sanitation, as I said. And the main source of funding for the utility are own-generated revenues, government subsidies. The utility still receives subsidies from government, and other sources come from DPs and private sector. WASAC is able to develop its own water and sanitation projects. And as I earlier mentioned, they manage directly the urban water and sanitation services, whereas the rural services are provided through a delegated management arrangement by licensed private operators. Water, if I talk a little bit about water provision under COVID context, as other colleagues have mentioned, I think this COVID came with increased demand for water, and we have seen new places requiring water and enough water, like marketplaces. So the demand didn't increase only for households, but it has also increased for new places like markets. And the COVID requires continuous water supply, uninterrupted supply to households and all other places, including markets and healthcare facilities. And again, the other challenge, which is shared by all, is the continuity of service for low-income earners. So all of those combined have really created some big challenges for the utility, similar to other utilities in the region. We have also seen some big consumers like industry and schools closing, and for a time of 40 days of country lockdown, those big consumers could not for sure consume and pay. This has affected very much the revenues, especially the collection, because of limited mobilities, officers going from house to collect data from water meters could not do the work. And WASAC has been obliged also to develop urgently some new infrastructure, especially to serve new consumers or new places that were requiring water services. COVID came with a lot of challenges on operation and maintenance on even existing networks. So some measures that have been taken by the utility, say for the revenue collection, they have put in place platforms to encourage consumers to self-declare using, I think I have heard about this same arrangement in other utilities, taking a picture of the water meter and sending through WhatsApp to the utility. They have also encouraged some digital platforms for payment, including mobile money. WASAC has reinforced protective measures at all project sites, including PPE and physical distancing. You can continue, Ronnie, with next slide. A lot of learning. I think WASAC is learning. All of us are learning lessons that will be definitely useful today and for future interventions, even when the pandemic is contained. WASAC was first to embrace new technologies in operations and maintenance and revenue collection, as I earlier said, and leakage detection. They have been forced to install SCADA systems for remote monitoring. You can continue. I think that's the biggest learning. How to deal with consumers even without a physical presence, and how to quickly install monitoring systems on existing systems and the new systems, and how to be agile in setting up new infrastructure or new systems to serve newly developed areas of demand. That is the quick, very brief summary from WASAC. If you have questions, I will try to respond to some, but also I know on the webinar we have many colleagues from Rwanda. Some of them know very well the context. They will be able to also intervene and help to respond to some of the questions that may arise. So thank you very much. Over to you, Ronnie.
Great. Thank you very much, Maurice, for taking us through WASAC presentation. I think this is a true reflection of a strong partnership. You spoke like an employee of WASAC. Well done. So colleagues, quick questions to Maurice. David, over to you to manage the questions. And whilst the questions are being presented, Jessica, kindly get ready with the key takeaways.
Thank you very much, Maurice, and thank you very much, Ronnie. I think there was a question that was generic. I would like Rob kindly ask the question. Rob, you had a question that you had posed for all the utilities, and I think this is an opportune time to ask that question.
Thanks, David, and I'll ask this very quickly. We know of a number of different initiatives and conversations ongoing, World Bank, European Union, DFID and others, who recognise the importance of utilities as a first-line response to COVID-19. What's less clear is what is actually useful for those institutions to be providing in terms of support to utilities in many countries at the moment. So I'm just be interested to hear, is it straightforward money? Is it technical support? Is it around operations? Is it around customers? Where should support best be targeted at this point to help us move those discussions forward into reality? Thank you.
Thank you, Rob. Can we have Dedo asking the question, Dedo? Or should let me ask on your behalf. Dedo asking that, can you let us know the kind of technologies that WASAC has applied during this era, during this period? And maybe to go to Segreda. Segreda, are you able to ask your question directly?
Yes, I just wanted to know, Maurice, in Kigali, if there is a rough estimate of how many people use public taps, because queues and collection time, especially if there is irregularity in water, will make more people at risk. And also in terms of mobile money, I don't know if the other country programs, it's not very common in many countries. At least it's not common in Ethiopia. So how, if you have a rough estimate of how many people use that?
I can see that Bruce has added on a comment on Maurice's presentation. Bruce, I think this could be a good time to speak on it. Over to you, Bruce, before Maurice comes and answers those questions.
Oh, thank you. It was just a clarification, just an addition to Maurice's presentation. Yeah, WASAC are responsible for water supply services, and there is a private state-owned company, as mentioned by Maurice. However, in rural areas, WASAC is only providing a service in urban areas, mostly in the city of Kigali and in other secondary cities. But in other rural places, the services are provided by individual private operators who are individual companies who sign contracts, mostly 5 years, with the respective districts to provide water supply services. And normally they enter into a contract. They have a uniform tariff set at national level by the regulator, and then they enter into an agreement where they pay some royalty fees to the districts and also pay the relevant taxes, the applicable taxes in the country. So that's what I wanted to add. WASAC is the solely utility in the country, if I can say, but they don't operate in the rural areas, even though they have the mandate to provide technical support.
Okay, thank you very much, Bruce. Over to you, Maurice. You can take the question, those which you can answer.
Yeah, thank you, David, and thank you, Bruce, for the addition. So Rob asked a good question actually about the involvement of development partners, and so I think this is a big issue. I don't know the situation in other countries, but when I look at my country, Rwanda, water is not given its due consideration by development partners, for sure. We have African Development Bank, which is funding a bigger project of sanitation in Rwanda. Yes, that is really good. But when you look at, say, the response to the COVID, I have been attending the DP's meeting. There is not even a technical working group on water. And that has been my first question when I attended my first meeting. Who is assuring, for example, that all healthcare facilities have water now? Healthcare facilities are critical areas where people are going for treatment. They are responsible for isolating people. So are we sure there is someone who is looking at availability of water in healthcare facilities? Is there any development partner looking at availability of water in schools? In Rwanda, schools are closed, but there is a hope to reopen in September. Who are development partners involved in ensuring that, for example, when school reopen, water is readily available in all schools? So I can say that it's an area of advocacy, Rob. At some point, development partners had, I don't know, it's not losing interest, but had turned away from investing heavily in water. But time is now teaching us that this is an area that is vital for any other development. So it's an area of advocacy. That's how I can put it. So Dedo, about the technologies applied by WASAC, I think I mentioned about remote monitoring of systems and the digital payment. That's the two that I can mention right now. But if other colleagues who know WASAC or had also benefiting from WASAC services can add something, they can. But at the moment, I can mainly mention the remote monitoring of water systems and the digital payment platforms reinforced. Secretary, about the percentage of Momo use, I don't know much, but in Rwanda, almost 70% of households have telephone and they have Momo service. So I assume that this is my own assumption. I assume that 70% of WASAC consumers can pay through Momo. Doing it is another business, but they have at least that platform, that option, that possibility of paying using mobile money, which is the easiest actually. So issue of public taps and congestion at public tap, again, Secretary, if you had our advocacy messages in the TV and the radio talk shows we have been conducting, this is one of the point of advocacy, making sure that there is a right physical distancing at public taps, because physical distancing is now being observed on road, because eventually people know there is police also watching, in healthcare facilities, in the market, because there is someone to regulate. But when it comes to water point in rural area, these are really, really dangerous place that can where people can contract coronavirus. But we are advocating, we are putting pressure on the local leaders to ensure that there is a control of physical distancing at public water taps. Thank you. That's what I can say, but my colleagues can add on.
Thank you very much. Thank you very much, Maurice. For the interest of time, I know there are quite some very interesting questions which are on the chat box. I know one from Tekaling and another one from Atta Benson. We will ask Maurice that you may just kind of like answer those questions on the chat box as well, so that we can allow Ronnie to invite someone before we conclude. Ronnie, over to you.
Thank you very much, David, and thank you very much, Maurice and Rwanda team for response. I think this marks the end of the presentations from the 5 utilities. I think we need to acknowledge and appreciate all the information and experience that has been shared. Let me quickly invite Jessica in just a few minutes to give us 5 or so common issues that are coming out of this webinar. Jessica, over to you.
Yes, good morning, good afternoon, everyone. Jessica Senyonde is my name. I'm the Regional Advocacy Manager for WaterAid East Africa. Yes, a number of issues, recommendations have come out from these brilliant presentations. And just to give a few highlights briefly, yes, it has been mentioned that we need to continue working in collaboration with others to come up with a joint plan to be able to fight COVID-19. We also need to continue supporting utilities in terms of creation of hand hygiene campaigns, and also in terms of providing touchless hand washing facilities. And we also need to advocate for the adoption of a human rights-based approach to self-wash, specifically to those who are in informal settlements and those who are in very high-risk areas. Another key aspect that came out was the importance of building strategic partnerships, especially in this fight of C-19, but also in realizing SDG 6. The aspect of fundraising, mobilizing for resources to implement the emergency plans developed, that also came out, and of course, continuous awareness creation on C-19 for both staff, but also the general public, and the need to build on the existing infrastructure. For instance, not reinventing the wheel, but also building on some of those wash platforms that are already in existence and the institutional setup that is already in existence to help fight C-19. And yes, Ethiopia also did talk about the aspect of a specific budget allocation towards vulnerable groups and those who are living in high-risk areas, and also ensuring that in this particular moment in time, looking at the aspect of free operation and maintenance costs for those who are in high-risk areas, specifically the urban poor. Yes, the aspect of provision of PPE for WASH workers came out strongly, and the need to put in place effective communication tools to sort of continue dialogue with customers in case of complaints and specific needs, and working in shifts for those who are working in utilities to ensure the COVID is not spread amongst staff, and also the aspect of awareness creation of the different protocols that governments have put in place. The governments have put those protocols and proclamations in place, but majority of the public are not aware of what is in place. So the need to create awareness on those, and also the aspect, I liked what Kenya came up with, the aspect of coming up with some kind of messaging clip to create awareness creation on the whole process of water treatment, so that the public may have a general understanding of what is involved, and this can act as a stimulus for them to be able to pay the bills, the necessary bills needed, and to also lobby for subsidies from both levels of government, and the need to have contingency budgets and plans to be included in tariffs, or to be at least catered for when they're developing their emergency plans and future budgets henceforth. Yes, something came out about coming up with proper initiatives being developed, and colleagues from Tanzania did mention developing a proper water strategy. They also talked about, yes, continuous installation of inclusive hand washing facilities, and of course the aspect of collaboration with others continued to come up. And another thing they did mention was that good hygiene practices should not be just a one-off. It should be a lifestyle for everyone to consider. And they also mentioned the need to come up with a community assessment to be able to identify those who are most in need, especially without access to water, and what can be done for them accordingly. So the aspect of a community assessment to identify the needs of those who are more hit by this particular pandemic. Yes, there's also the aspect of appealing to government, yes, for subsidies, the aspect of fundraising, and also continuation to lobby for no disconnection for those who are still being charged some bills. So they need to lobby for no disconnection for all customers. And with regards to the last presentation, what I did pick up was the need to embrace new technologies, especially around operation and maintenance, install monitoring systems on those existing systems in place, but also be agile when it comes to installing wash facilities, specifically in strategic places. Back to you, Ronnie.
Great. Thank you very much, Jessica, for those comprehensive key takeaways. I know colleagues, we have been asking the question whether we are going to share the presentations. Yes, definitely we are going to share the presentations. I hope you have dropped your email in the chat box so that we can share the presentations and also this recording with you. I know time, we are way beyond the designated time. Our apologies for that. But let me quickly invite Jacob to give us a vote of thanks, and we conclude this webinar. Jacob, over to you.
Okay. Thank you so much, Ronnie. My name is Jacob Metena. I'm the country director for WaterAid Ethiopia. Yeah, it's quite a learning session. I would like to thank the regional office for coordinating this call, and also all the countries and utilities who have contributed to the discussions. I know one can imagine the efforts made for this to happen. the actions shared in responding to COVID, lessons from actions, and also the inclusivity. All of them are really an excellent learning exercise. All the presentations shared and the thoughts exchanged revealed how crucial is the service provided by utilities. I can say all the utilities are on the front line in the fight against COVID. Yeah, we know we are in a changed context, which was not predicted 5-6 months ago. However, we can understand the pressure put on utilities as the COVID issue is yet to sustain, to stay with us. We can also further imagine the pressure would be increasing further. So I think we can join hands. In all the presentations, we can learn that there is an increased demand for water that is further added with the emergence of COVID. Sustaining the service and also sustaining utilities remains to be an agenda. We need to further look on what would be our asks. I know governments are also engaged in many areas to manage the impact of COVID, but also in East Africa, I think there are some governments who are making a kind of economic stimulus, like allocating funds. But how can we frame our demands to ensure utilities are sustained and also the services sustained? I think we can also think of how can our WASH agenda can be taken in its totality, and also how can we use the opportunity of COVID to really change the hygiene behavior among the public. I'm hoping the organizers would compile this document and share us, and also see how really we can come again to further learn from one another. My thanks again goes to the regional office and also utilities and all the presenters involved in it. Thank you so much.
Thank you very much, colleagues. Thank you very much, Jacob. This marks the end of our webinar. Wishing that you all stay safe wherever you are. Have a good day.
Thank you, Ronnie.
Thank you, Ronnie.
Thank you, Ronnie.
Ronnie,
thank you, Ronnie.
Thank you, Ronnie.
Bye.
Thank you and bye.
Thank you.
Thanks, Ronnie.
Hello.
Thank you so much.
Bye-bye.
Hey.
Thank you.